Hello friends, welcome to CNS Viewpoint. Today we are going to talk about are we really able to break the chain of transmission of coronavirus? As you might have read that 2022, the new year began. The first week of 2022 had the highest ever number of coronavirus cases, weekly cases, um, since the beginning of the pandemic. So as of now, since the pandemic began, we have more than 306 million cases of coronavirus, COVID-19, and over 5.5 million deaths at least. And we all know that these are underreports. The actual number of people who are infected with the coronavirus disease or COVID-19 and who died of COVID-19 could be much higher in different places, in different countries, in different settings. So, so are we able to break the chain of transmission? Because we had no cure, and we still have no cure of COVID-19. But um, but from very early on in the pandemic, more and more evidence has come how to prevent transmission, how to prevent getting infected from coronavirus, whether it is wearing proper masks or whether it is social distancing, physical distancing, or it is avoiding crowded spaces, or it is policies, COVID appropriate behaviors around social mixing, around other public health policies, workplace policies, etc. So about testing, diagnosis, about a lot of evidence on diagnostics, a lot of evidence on clinical management, whatever exists, what works, what does not work, a lot of evidence on what does not work. Vaccines, a lot of advancements have happened. So a lot has happened on how to break the chain of transmission of coronavirus or help break the chain of transmission of coronavirus. So for example, even diagnosing timely can help reduce transmission. Social support systems where people can self-isolate or isolate in uh, institutional quarantine or isolation facilities. Even this that can help reduce transmission. Building confidence of people in public health systems, in social support systems, in institutional systems. Trust and confidence it's paramount. Is I think rights-based access to all kinds of health services and social support services is so important, especially for the people who are most marginalized or most at risk of being left behind. We all need to remember it is not most at risk people or hard to reach people. It is the services which are hard to reach. It is not the people who are hard to reach. It is the services that are hard to reach. So we need to look at how we are programming health and development. So coming back to breaking the chain of transmission. So if there are 306 million at least recorded cases of COVID-19, this means there are 306 million failures to prevent the transmission of coronavirus. That's a huge amount of failure. And even now we are failing. If you look around, especially right now I'm in India, and when I go out, I don't see much of COVID appropriate behavior in place. And it is not the people to blame. What about those government support systems to help support people to adhere to COVID appropriate behaviors and be able to sustain their livelihoods, sustain their lives? It's not a matter of 1 or 2 days, it's more than 2.5, 2 years. So so we all need to look at a more comprehensive approach to infection control. So, as we all know, coronavirus cannot survive outside of a living cell. So, breaking the chain of transmission of coronavirus is such a central cog in the wheel of infection prevention or disease control or infection control. And I think that's achieving or helping or moving towards inching towards zero infection rate. I think that new infection rate that should have been that must be one of the most important public health indicators. And if you look at the WHO weekly updates over the last 2 years, you will find that the number of corona cases reported every week have not gone to zero in any part of the world, in any region of the world. They have dipped, at times they have peaked, they have plateaued. There are certain geographical areas which might have reported less cases, no cases for some time, for a certain amount of time, for a bit longer time, like Thailand, New Zealand, or maybe some other geographical areas. But by and large, the, even when coronavirus cases were less, they were quite alarming. For instance, in India, thousands of people were getting infected with COVID-19 every single day. If you look at the previous record of each and every day in December, November 2021, October 2021, September 2021, August 2021, July, June, May, April. Of course, May, June were peaks. But what about before and after? Like, number of cases was very alarming even then, even if it was much lower than what the peak was. So 10,000 cases, for example, or 20,000 cases, 30,000 new cases, 40,000 new cases is a lot of cases. So I think, was setting our eyes, because this is doable. Wearing a mask is doable. Then the ventilators, oxygen, and all the kind of health infrastructure which you need if people get infected with COVID-19. Lives are precious, and if lives are precious, then we need to walk the talk on that and really help support people so that they are able to adhere to COVID appropriate behaviors and help us attain and achieve um, um, zero infection rate and break the chain of transmission of coronavirus if they happen to get infected. So I think that is extremely important. And moving beyond, I think governments are going for namesake measures, for example, night curfews. So Dr. Soumya Swaminathan, she is the chief scientist at World Health Organization, she said in a news that there is no science behind night curfews when it comes to tackling the spread of COVID-19 variants. So this is really important what he has said. After all, major infection transmission is likely to happen due to social mixing and crowded places during the day. Merely imposing night curfew is not going to yield the desired public health outcomes. Dr. Swaminathan said that politicians and policymakers need to start balancing the scientific and evidence-based methods. We have to control COVID-19 transmission and reduce the impact on people, particularly reducing deaths and hospitalizations, while at the same time keeping economies open, making sure livelihoods are not impacted because people have suffered enough. And Dr. Soumya Swaminathan is bang on the spot on that. This is exactly what we need to do. I think we will end um, this CNS viewpoint here. But before that, let me remind what Dr. Tedros and repeat what Dr. Tedros Adhanom Ghebreyesus, the Director General of World Health Organization, said that Omicron should not be categorized as mild. Uh, um, so Dr. Tedros Adhanom Ghebreyesus said, WHODG, that while Omicron does appear to be less severe compared to Delta variant of coronavirus, especially in those vaccinated, it does not mean it should be categorized as mild. Just like the previous variants of coronavirus, Omicron is hospitalizing people and is killing people. In fact, the tsunami of cases is so huge and quick that it is overwhelming health systems around the world. He's bang on the spot. So let us hope that governments go for science-backed measures, evidence-backed measures, and not namesake measures like night curfews. And the social support systems and efforts to um, strengthen or regain trust of people in institutional systems, social support systems, so that they can be helped, supported in adhering to COVID appropriate behaviors goes alongside strengthening health systems, healthcare services for all kinds of diseases um, which make us ill. So let us hope that health for all really becomes a reality, and zero COVID infection rate also becomes a reality more sooner than later. So with this hope, let me end today's CNS Viewpoint, and I will be back again tomorrow at 5 p.m. India time with the thoughts and views and perspectives on something that made us think. Bye till then.